I'm Dr. Bill Adams, and this is No Spin Live, everybody's favorite program where they learn about hot topics in plastic surgery from the world's best plastic surgeons. Joining me is Dan Del Vecchio from Boston, Massachusetts, Rich Restifo from New Haven, Connecticut, Stephen Camp from Fort Worth, Texas, and Rick Zinowitz from Providence, Rhode Island. Guys, let's get into it. Let's talk a little bit about fillers. You know, you can put those in the nasolabial folds to fill those out, but what about things like around the mouth or under the eyes? Can you do that, and is it beneficial to patients? Dan Del Vecchio, you want to lead us off?
Yeah, Bill, I mean, I think fillers are great. I think that you've got to think about off the shelf, lunchtime, come in, come out, versus fat grafting. And, you know, this whole science of nano-fat grafting that's kind of taking over, that patients need to know about small little particles of fat, probably rejuvenate better. The problem is it's a longer procedure, 2 hours in the office. I think fillers definitely have a role. There are some safety issues around the eye, and I'm sure we'll get into that, but I think fillers are great.
Stephen Camp, what do you think? Where else can we use fillers?
Fillers are great to really shape and mold the face in a positive way. I found that treating the temples and areas around the mid-face and cheeks are really forgiving and beneficial to patients. They're quick, easy to tolerate, and really associated with any very little complications like bruising or downtime. So those things are well received and great treatments for patients. It's certainly a good option.
Rick Zinowitz, what do you think? The eye can be a place, I think you can put fillers, but it can be dangerous.
So one of the biggest boons to injection recently is a micro cannula. I know it's been used in Japan and in Europe for a number of years, also South America, but it's more recently available here in the United States. It takes a lot of the worry out of injecting because you're presenting a blunt tip to the tissues, which is very unlikely to penetrate a vessel and cause some embolic phenomenon. So I found that it's much easier to layer the material down. It's not heaping blood and serum onto the tissues that you're trying to augment, so you get a more predictable outcome, I think.
All right, Dr. Restifo, you're going to have the last comment on this. Sum it up for us.
Yeah, I'm going to be a contrarian here. In the aging face, are we dealing with volume deficiency? Or are we dealing with skin laxity? I would say that fillers, sure, they can be used, but they should be used in limited quantity.
Great information. I think I've learned a lot today. I'm sure our viewers have as well. If you want to see more of this, you can find it at theplasticsurgerychannel.com.